going to give you my gray hair.
Oh, Logan gave me my first gray hairs. So,
oh my goodness.
Yeah, how that goes. And, oh no, I'm going to refresh them. All right. And we're live, Dr. Tom.
We're live. Hello. It's 4 o'clock Pacific, 6 o'clock Central, and here in Costa Rica, 7 o'clock on the East Coast. It is midnight in Dublin and London, 1 a.m. in Warsaw, 5:30 a.m. Wednesday morning in New Delhi, 10 a.m. in Brisbane, 1 p.m. in Auckland, and it's Facebook Live. Well, I've got the dates or the times now correct, don't I? Hello, everyone. Nice to see you. You can start filling in your questions. Our primary focus tonight is on cardiovascular disease, but just throw your questions out there as we get started. I wanted to begin with an OMG for me that happened recently, and it's on a product that we have on our site. We'll put a link here. It's called Cardiotone. And I want to start by telling you a story. First, let me say hello to Gracie and her family in Iowa. Hi, Gracie. Thank you so much for being here. Gracie and her family are there every week, sitting at the dinner table, watching Facebook Live with theDr.com. And I think this gal is got a very, very bright future in helping hundreds of thousands of people. She's just so focused on health. And way to go, Gracie, way to go. So Marzi and I have gone to the Swiss Mountain Clinic a number of times over the years. It's the go-to place in the world if you really want to have the best in-house facility to deal with chronic degenerative diseases or to get healthier, just in general. They're just the best, and I've spoken of them many times. So I think it was the first time I went, I think so. And one of the things they did is called live cell analysis, where they poke your finger, put a drop of blood on a slide, put it under a microscope, and it comes up on a television screen. So you can see your blood. And we used that testing procedure back in we started with it back in the mid-'80s, 1980s. It's helpful. It's really helpful. You can see a lot of different things that aren't supposed to be there, and if you have enough of the things that are supposed to be there. And so they did that for me, and I'm sitting there, comfortably watching, and all of a sudden the television screen comes up, and I said, "Oh no, that's not my blood. That's no, Dr. O'Brien, that's your blood." And no, that's not possible. But it was. And, red blood cells are round shape. It's really interesting. The most efficient shape that physicists tell us in the world, it's not a circle, but it's a concave, meaning a concave. And red blood cells are concave on one side and they're concave on the other side. They're the most efficient form to carry oxygen and iron and many other functions that they have. But my red blood cells were stacked on top of each other. It's called a poker chip formation. And when they stack on top of each other, now you don't have just one red blood cell or millions of them in your bloodstream. Now you got clumps of red blood cells. That's what forms clots. And clots are what cause heart attacks and strokes. There's two kinds of strokes. One where the blood vessel breaks and you just bleed throughout your brain, and the other where a clot blocks a blood vessel and the tissue doesn't get enough blood on the other side of that vessel where it's blocked. Well, I had poker chip formation, and my jaw just dropped. And I had been traveling a lot. I think probably flew about 160,000 miles that year. It's been a long, hard year of traveling and speaking and not getting enough sleep at times and all that, blah, blah, blah. But it startled me. And I knew immediately the risk that has, having a poker chip formation. My dad had died of a sudden massive coronary and many years prior at the age of 64. And so I knew I had some genetic vulnerabilities probably to this, and I took it very seriously. So they said, oh my, I'll make sure to let the doctor know because the technician does the tests. And I said, that's fine. Yeah, I'll talk to her. I'll talk to her tomorrow. And the next day I came back first thing in the morning and I said, let's do that test again. And the therapist was very nice and polite and said, oh, yeah, okay, Dr. O'Brien, but it won't be any different. There's no need to do it again. So I understand. Let's just do it again. And so she did it again, and my blood was almost normal. And her jaw dropped that time. And I just went, yes, yes. And at that time, Cardiotone was still in the research phases and it wasn't available yet, but I had it with me. I happened to have it with me and I hadn't been taking it yet. I just had it in my suitcase. So that day after I saw my poker chip formation, I went back to the room and I took 2 of them. The dosing is 1 of them once or twice a day, depending on your body weight. It's very safe. You could eat many more and it's okay. But I went back and I took 3 of them. I believe it was 3 of them twice that day. And the next morning I went back to say, let's do this again. And sure enough, it was almost normal. Now that is impossible, just impossible. If you tell a doctor you've got a poker chip formation and the next day it's almost normal. I said, no, it's not possible. There's no drug that can do that. Well, actually there is. And it is a product called nattokinase. Nattokinase is an enzyme. And in Japan, there is a type, this whole thing about eating fermented foods. And it's accurate. Many of you have heard me say many, many times how important it is to eat a little bit of fermented vegetables every day and alternate the fermented vegetables you eat, because each family of vegetables that ferments feeds different bacteria in your gut, and you inoculate with more of the good bacteria. And we need many, many, many different strains of good bacteria in our gut. And you won't get all those different strains if you just eat sauerkraut every day. Sauerkraut's good for you, but you alternate it with kimchi and with miso and with fermented beets and with curry flavor. And there are many, many different kinds of fermented vegetables now. Well, the Japanese version of that is called natto, N-A-T-T-O. It's fermented soybean paste. And there is an enzyme in natto, and natto just tastes nasty. It is, when I was in my early 20s, I lived in Japan for a while. I lived in a martial arts school, and the guys, once they accepted me and we were going out drinking and eating sushi and stuff, one of the times they set me up and they ordered some natto for me. And they said, oh, Tom-san, very good, very good, very good for you, very good. And so I took a bite of it and they're all watching and they just started roaring because it is the most awful tasting stuff. Oh, you really have to have you develop a taste for it. It's nasty tasting, but it's very high. The enzyme in natto is called nattokinase. And nattokinase, I'm going to show you a few slides that I put together about nattokinase. So let me see if I can bring them up here for you, and Ann will make sure that I can share screen. And so let's just talk about nattokinase a little bit, because it's so important. And given that cardiovascular disease is the #1 cause of death in the world, the more you know of how to protect yourself and your family, the better. So in this study, they tell us that nattokinase is a unique natural compound that possesses several key cardiovascular beneficial effects for patients with cardiovascular disease, and is therefore an ideal drug candidate for the prevention and treatment of cardiovascular disease. Nattokinase is a promising alternative in the management of cardiovascular disease. So they publish with this kind of language because they're hoping that some drug company is going to pick up on this and start using the product. But it's not profitable for a drug company, and they can't patent it because it's part of the natural food in Japan. So no drug company will pick up on it. But the results of using nattokinase are just jaw-dropping. It's believed that it's a significant contributor to the longevity of the Japanese population. They are the number one, always number one, or number two, or number three. For the last, I've been checking for about 20 years. The World Health Organization rates the longest living, most vital people around the world. And Japanese people are always up at the top, always up in the top 3 or 5. Recent studies demonstrate that a high natto intake was associated with decreased risk of total cardiovascular disease deaths, meaning from any type of cardiovascular disease. And in particular, a decreased risk of death from ischemic heart disease, which means not enough blood flow getting to your heart because your pipes plug up. And this is the drawing in that study where they show you that when you have the enzyme that's in the food natto, now I'm talking about the enzyme. I'm not going to recommend you, if you want to eat natto, you can, but nattokinase is the first ingredient in the product cardiotone. So that's why I'm talking about it here. And when you use nattokinase regularly, and you'll see the studies here, 26 weeks, when you do it, what you see is anti-atherosclerotic and lipid lowering, meaning your cholesterol goes down. If your triglycerides are too high, the triglycerides go down. The good cholesterol goes up. Your blood pressure comes down, both the higher number called systolic and the lower number called diastolic, they both come down if they're high. If they're normal, they're fine. They don't change. It decreases the fibrin. Now, fibrin is the stuff that forms the clots that makes your red blood cells stick together in that poker chip formation. It has neuroprotective effects. We won't talk too much about that one tonight, another time maybe. And antiplatelet and anticoagulation effects, meaning clots in general, are reduced dramatically when you take nattokinase on a regular basis. Daily nattokinase supplementation was an effective way to suppress the progression of atherosclerosis in patients who already have plaque in their arteries. You know, you do a calcium score, and if you've got some plaque in your arteries, and most of us do, this is the #1 cause of death, which means most people, their pipes are plugged up, hopefully not too bad, but their pipes are plugged up. This is the #1 cause of death. And you feel fine now, but 10 years from now, 15 years from now, who knows when the process of your pipes plugging up gets bad enough. Now you've got ischemia, not enough blood getting to the muscle, and here comes that heart attack. But daily nattokinase supplementation was an effective way to suppress the progression of atherosclerosis in people who already had plaque. Our studies found that in patients who had high cholesterol, high triglycerides, nattokinase treatment for half a year reduced total cholesterol, reduced the undesirable bad cholesterol, reduced triglycerides. In addition, it increased the good cholesterol, the HDLs. And there was a significant reduction in the carotid artery. Those are the big arteries that go up to your brain. And this is part of the neuroprotective effect. And most people have some plugging up in their carotid arteries by the time they're in their 40s. And it progresses at a quicker pace every year. But most people do, not everyone, but most people do. But when patients did nattokinase treatments for 26 weeks, there was dramatic reductions in the amount of common carotid artery muscle thickness. And it was a 36% reduction in the size of the plaque in the arteries. And it was an 11% reduction in the muscle of the artery and how thick and plugged up it was. The reduction in the nattokinase group was more significant than that in the group treated with the statin drugs. When you read this kind of a study, you say, wait a minute, what did you just say? And you read it again and you say, oh my gosh, well, how come the whole world isn't on this? Because there's no profit in it. So it's not being marketed to doctors, and doctors don't take nutrition courses in their medical education. After they get out of school, or they get very few nutrition courses, and I'm not showing you the studies tonight, I know that. But after they, oh, Gio, come here. Yeah. Oh, Gio's saying, Daddy, come here. Oh, thank you. Come here. You want to say hello? You want to see Ann? Oh, Gio brought me a cracker, so I have to take a bite of my cracker. Just a minute. Yum. Oh, yum. Thank you. Thank you, honey.
Thank you, Gio.
Well, that's it for Gio. Thank you. Oh. Yum. Yeah. Yeah. So there's no drug that's ever been shown to do what this enzyme does. There is just no drug that can do that. Our data suggests that nattokinase was a better alternative to statins, a commonly used drug to reduce atherosclerosis. And furthermore, nattokinase could be a viable alternative therapy for cardiovascular attacks and stroke in patients. And they summarize that 26 weeks of taking, so that's a half a year. And you see these kinds of dramatic results. For me, I'm on nattokinase every day, and I won't stop after half a year. I did a calcium score on myself about 8 months ago, and I had 30% blockage in my coronary arteries. Now, that's not life-threatening, but it's not great. And so I just got on nattokinase right away, and I'm going to wait for another 6 months, and a year from now, I'll do another one, and we'll compare, and I'll let you know what the results are when I do that. Oral administration of nattokinase for 8 weeks resulted in a reduction of both the highest number and the lowest number of blood pressure. You know, it's usually 120 over 80. That's a good one. But the top number went down 5.5 points, and the bottom number went down 2.84 points. That's significant. That makes a difference in people's lives. The results suggest that nattokinase could play a role in the prevention and treatment of hypertension. Recently, a study suggested nattokinase consumption for 8 weeks was associated with beneficial changes to blood pressure in patients that have hypertension. This is consistent with several laboratory studies that have shown similar results in test animals. Low-dose aspirin is a potent anticoagulant agent widely used for the prevention of heart attacks, stroke, and atherothrombotic diseases. We all know about taking aspirin a day, a low-dose aspirin a day. And aspirin exerts its effects by stopping the production of this thing called thromboxane A2. And I don't want to get geeky with you, but it stops the platelets from getting so sticky. That's what aspirin does. But the long-term use of aspirin comes with serious gastrointestinal side effects and bleeding. It gives you leaky gut, which gives you systemic inflammation that we've talked about many times. So we never recommend taking aspirin because of the long-term consequences of taking it. In a study comparing the antiplatelet effects of nattokinase and aspirin, nattokinase was shown to display excellent antiplatelet aggregation and antithrombotic activities. That means not sticking together, not getting all clumped up and forming clots. All the above data suggests that nattokinase could be a good candidate without any obvious adverse effects for the improvement of blood flow and possibly superior to aspirin. Takes a lot of guts for researchers to use this kind of language because they're going against the commonly conceived notion that aspirin's good for you. No, it's not. On occasion, you get a headache, take an aspirin, it's fine. But even a single dose of aspirin affects your gut. Single dose. I'm not showing you the studies tonight, but we've got plenty of that kind of information for people. So I'm going to stop sharing my screen right now. And I've got many studies on this kind of thing. I just showed you 3 here, but this one caught me and I didn't make the slides for it. I think you can see the title of this one. I can't read it backwards. A single dose of oral nattokinase potentiates thrombolysis and an anticoagulation profile, meaning the first time you take it, you start having less clots forming in your bloodstream. So it's not that you have to wait 26 weeks to see any benefit. You get it right away. And so I took Cardiotone when I was at Swiss Mountain Clinic, and you get benefits right away. And I took a larger dose. I took six tablets that day because I was just in shock as to, whoa, well, we'll take care of that. You know, and I just took them because I knew it was safe to do it, and saw the results the next day. I was trying to find the pictures. I want to show you the pictures. I can't find the pictures. I don't know if I sent them to Ann or not, but Ann, if you've got them, see if you can pull them up and then let me know, and we'll show the pictures. But I can't find them on my computer, which is unfortunate at the moment because they're jaw-dropping to see that. So nattokinase is the #1 ingredient in Cardiotone. It's the first ingredient, and it's a critically important, I think, component that we all need to take because of the cardiovascular disease is the #1 cause of death. So we've all got this problem. And my light just went out, so I'm trying to find the switch. There it is. Hold on a minute. There's always something, isn't there? There we go. Let's hope it stays now. Like that. Doesn't do that again. So let's see here. I want to say hello to some people. Ann's posted some of the, there's the questions. So I'll go to the list of questions and then come back to say hello to people. Is there alcohol in the tinctures or nattokinase formula? No, there is not. The only thing that's added to Cardiotone is maple syrup. And I've always said organic grade B maple syrup, but someone sent me a message last week from Facebook Live, thank you very much, and called me out and said, there is no such thing as grade B maple syrup. And I've read that and I said, what are you talking about? But then when I looked, it turned out in 2015 that the maple syrup industry decided not to use the term grade B anymore. And but our suppliers never told us this. And their stuff still comes in big 5-gallon containers labeled grade B organic maple syrup. But thank you very much for that, because I now know to refer to it as grade A dark amber organic.
Hey, Dr. Tom, it's Ann. I'm going to go ahead and post the ingredients of Cardiotone because there is no maple syrup. These are pills and not tinctures.
Oh, thank you, Ann. Thank you so much. We'll post all of them there. Yeah. So I'm thinking almost all of the Sunhorse products have some maple syrup in there. But as you asked about the alcohol, that's what caught my attention there. I'm so grateful to have a staff that keeps me on my toes. Thank you, Ann. Heather's on Zoom and she said, please advise on what supplements not to take with nattokinase says to avoid bleeding. Oh, that's a really good question, Heather. The only one that I can think of that would be a problem would be hydrochloric acid. And it's not that you can't take hydrochloric acid, but taking excess amounts of hydrochloric acid, especially if your stomach is not in a protective state right now, if you've lost some of the mucus lining, that could be a problem. But in terms of taking Cardiotone, and if you're taking digestive enzymes or anything like that, not a problem at all. I can't think of a reason why you would ever have an issue with that. And I do take some other enzymes. I take the Cardiotone first thing in the morning, and sometimes before I go to bed at night, not usually, but sometimes I'll take a second one with dinner or before going to bed. But I also take in the evening Wobenzyme. I've used Wobenzyme for many, many years and recommend it quite a bit. I think of Wobenzyme as Pac-Man. They're scavengers going through the system. And so I see Ann's posted the ingredients here on the label and it's not posted here, but it's nattokinase. And then after that, pine bark extract. Now, pine bark extract, that's where you get pycnogenol. And if you Google pycnogenol and cardiovascular health, there are many, many, many studies. It's been used we started using pycnogenol when I opened my practice in 1980. So it's been around a long time. And there are many different forms of pycnogenol. The French pine bark extract is the highest quality that we're aware of, and that's what we have in this product. Marrow root's in there, and marrow root is a really powerful adaptogen, just tones your muscles and has a toning effect for cardiovascular health. This is just a great product. You'll see the list of all of them there. I'll come back and talk about more of them as we progress here. Joan asks, will serrapeptidase and lumbrokinase work the same as nattokinase? Really good question, Joan. I haven't seen any comparisons. Both of those enzymes that you're referring to are excellent enzymes. They work well. The reason I like nattokinase is because it's in cardiotone. And the whole concept of adaptogenic herbs is very different than just taking a particular supplement. The visual that seems to work for a lot of people when taking adaptogenic herbs is this. When you have a master formulator, like Sunhorse Energy does, 1 + 1 = 3. That the merging of the different components in a specific order, in specific concentrations, that process pulls, it's called global resonance formulation. And that the herbs resonate together in such a way that the adaptogens act as the spear. And when you throw a spear, and the active ingredient that you're really wanting to deliver inside the cell is on the point. So the point of the spear, in this case, nattokinase, is on the point, and the adaptogens deliver the whole formula. It's not just nattokinase on the point of the spear, but the cardiovascular system and protection is on the point of the spear. That's why I like Cardiotone so well. And I saw results in one day on something that no one had ever seen before. And I've talked to many friends over the years since then. They said, well, that's not possible. And I showed them the pictures and their jaw dropped. And for sort of, I can't find the pictures today. But I could not say anything other than serrapeptidase and lumbrokinase. There are many studies that it's cardioprotective. It does a good job at reducing fibrin and reducing clots. So if you're on those, they're great. You may want to try the adaptogens with nattokinase, or if you're happy, if you're getting results. And if you don't know if you're getting results or not, in my opinion, the rule is test, don't guess. So you want to get a calcium score. Usually it's about $300 or so. It's not very expensive, relatively speaking. You go to the hospital and you lay down on, it's like an x-ray table, and they just they do a scan. Takes 5 to 10 minutes once you're laying down on the table. And they're looking to see how much calcium is in your pipes, because calcium will show up on x-rays. Bones are made of calcium and they show up on x-rays. So if you've got calcium in your pipes around your heart, and they've got it really sophisticated now, they can measure exactly how much is in there. And if you've never done a calcium score, especially if there's a family history of heart disease, You want to do a calcium score and just see, all right, I've been doing all these things to take care of myself and I feel fine. But as everyone knows, especially with cardiovascular disease, doesn't matter that you feel fine, that sudden death is not unusual in cardiovascular disease. So you want to make sure that what you're doing is working. So the rule of test, don't guess is a really good one. Well, I get my blood tested every year, my cholesterol's okay. Okay, but lots and lots of people have normal cholesterol levels and they have heart attacks. It's not high cholesterol that is always the culprit. There are many other things that may also contribute. So always better test, don't guess. And the calcium score is an inexpensive, relatively inexpensive way of finding out exactly where you are right now. And then you do it a year later after you've done a protocol. So for those that are on lumbrokinase or other protocols, great, stay there, get your calcium score so that you know where you are, check it a year later. If you're not happy with the results, then you might try another approach like the cardiotone that we're talking about here. I have learned that chewing nicotine gum can work to move the spike protein from the COVID jab away from a certain receptor in the body. Is this true? I've never heard that. And does nattokinase perform the same function? Well, that's a really good question. I was going to save that for a while, but I've got 3 studies that show nattokinase dissolves the spike protein. In the doses that you take for cardiovascular health, it dissolves the spike protein. And it dissolves the part of the spike protein that grabs onto the ACE2 receptor. And for those of you that have studied, I don't mean to geek out on you, I'm sorry. But for those of you that have been studying this, and more people have, because this has been quite a threat for the last few years, the virus, and it doesn't reproduce, it sheds like dandruff, right? But it only sheds inside the cell. It doesn't shed in the bloodstream. It sheds inside the cell. So, and how does it get inside the cell? It gets in through the ACE2 receptor. Receptor's like a catcher's mitt. Pitcher throws the ball to the catcher. And that's why we've always talked about lots of fruits and vegetables of different colors, because the colors are called polyphenols and they bind into the ACE2 receptor. So the spike protein, the virus can't get in because it's full of the good guys from blueberries and red raspberries, and the virus has a harder time getting in. Those early studies came out 2020 when we first started hearing about all of this, about this virus. But nattokinase dissolves the spike protein. And I was like, what? Well, that's a great added benefit by itself as a reason to take cardiotone and nattokinase. But I'm sorry, I've just never heard about chewing nicotine gum. There may be some studies on that. I just haven't seen them. Margaret's on Zoom and she asked, what causes left bundle branch? Have they come up with anything to correct this? Sure. Well, I shouldn't say it like that, sorry. I've had a few patients with it, and what it means is the electrical conductivity going through the heart muscle, it's not working right. You're short-circuiting. And there are many, many triggers to that. I had a patient a couple of years ago that had that problem, and I just asked the question out of the blue, when did they put a smart box on your house? And she said, well, how did you know that? Well, it was about 2.5 years ago. And when did all these problems happen with your heart? She said, oh, it was about 1.5 to 2 years ago. Hi. It was about 1.5 to 2 years ago. And so I had her just get the smart box off of the house. And the result was her rhythms calmed down, her arrhythmias calmed down, her bundle branch problems went away. So sometimes it's an electromagnetic pollution that can contribute to that. Sometimes it's a biochemical imbalance that can contribute to that. If you've been following us for a while, you've heard me say this many times. In some ways, it doesn't matter what symptoms you have. If they're chronic, meaning they've been around for a while, you always have to address reducing the inflammation in your body. Always. It doesn't matter if it's a left bundle branch problem, or if it's migraines, or if it's recurrent miscarriages. Now, they're very serious situations, but as a component of treating whatever the imbalances you have, you always have to include reducing the inflammation in your body. Because 14 of the 15 top causes of death in the world today are chronic inflammatory diseases, which means you got too much inflammation. Well, what about for left bundle branch? It's too much inflammation. Well, where's it coming from? That's the $1 million question, and that's what you have to look for. Where is the inflammation coming from? That is a primary approach for every chronic condition that we may experience. It's not the magic pill that fixes everything, but it's a mandatory to be included in whatever it is that you're dealing with. Quincy says, hello, Gio. Gracie says, hi. We're excited to announce we are expecting a baby in April. Oh, congratulations. Congratulations, Quincy. I can't help but think watching these live videos and learning from you the last 2 years has played a big role in restoring my health to get us to this point. We are eternally grateful. Oh, way to go. Way to go. May I suggest you go to the website growbabyhealth.com. Growbabyhealth.com. They're the best. And when you and follow what they say to the T, they're good friends of mine. My friend Michael Stone and his wife, they're OB-GYNs, obstetrician gynecologists. And one moment, please. The battery just died on my thing and it was making some noise in my ears. So now I'll just be without a microphone here. But they've delivered over 5,000 babies in their life between the two of them. And so their daughter, Emily, who's a nurse, Emily grew up at the dining room table every night. Mom or dad had to leave to go deliver a baby, almost every night. Didn't matter if it was a holiday or not. So Emily was born and raised in this world of pregnancy, fertility, healthy pregnancies. And Michael is the Marcus Welby of functional medicine. He is the guru that's taught so many of us. Just a kind man. Oh, kiss. Okay. Night, little boy. Yeah. Night, yes. Yeah. So Emily and Michael, they started Grow Baby Health. And Marzi and I followed their recommendations to a T through the pregnancy. And Marzi had a beautiful pregnancy, no complications whatsoever. And from behind, I couldn't tell that she was pregnant. She maintained a shape, her contours, but she was healthy, lots of energy. So please follow their guidelines. They are the best in the world. And I do everything I can to support them. But congratulations. That's really marvelous. Really happy for you guys. There's an anonymous question from Zoom says, natto is made from soybeans. I thought we weren't supposed to eat soy in general. That's true. But nattokinase, it's the enzymes from soybeans, not the proteins. And I rarely eat soy. If I'm in a Japanese restaurant, maybe I'm going to order some soybeans with salt on them, maybe. I'll eat a few, but I just don't eat it regularly. It's not a great food to eat regularly. It's not really bad for you. Excessive amounts of it can be bad for you. But nattokinase is the enzyme, not the protein. And your immune system should not have a reaction to the enzymes whatsoever. Really good question, though. Malena on Instagram says, hello, doctor. How to detox from heavy metals at home? Oh, that's really difficult. That's really difficult. That's not a 2-minute answer. You know, you really have to get an evaluation of the person and what's their current status. How are their bowel movements? How much water do they drink in a day? You know, what's their lifestyle like? How bad is the heavy metals? How aggressive do you want to be? You've got to have a really good elimination system before you start trying to pull metals out. You pull metals out just because a test came back positive, you start pulling metals out and you haven't worked the detox systems ahead of time, you run a risk of a lot of these metals getting into your brain. And so you just move them from one place to another. Some get eliminated, but some can go up to the brain. You know, at Swiss Mountain Clinic, their #1 rule is you always treat the queen first. No one gets treated for heavy metal toxicity in their first week at Swiss Mountain Clinic, ever, because you have to treat the queen. And who's the queen? The liver. Your liver is the oil filter in the body, and you have to clean the oil filter before you start that kind of aggressive detoxing to get heavy metals out. So I'm sorry, I can't give you a protocol to do at home because I don't know what your status is, right? The one thing you can do, make sure you have excellent bowel movements. Critically important that you have excellent bowel movements every day. Critically important. How do you get them? First, somewhere between 1/3 to 1/2 ounce of water per pound body weight. Critically important that you have enough water to carry and escort things out. Second, lots of fruits and vegetables, lots of fiber, root vegetables, so that you've got roughage to build the good guys in your gut. These are critically important concepts. My books go through, both of the books go through how to build a healthy microbiome, which is really, really important before you start detoxing. Anne's on Zoom. She says, PEMF keeps platelets from sticking and is recommended for people spending a lot of time on the computer or other screens. Does it work well together with nattokinase? PEMF, P-E-M-F. Sorry, I don't know what that is. So I can't speak to it at all. Tammy's on Facebook. She says, better than CoQ10. CoQ10 does not dissolve clots. CoQ10 is excellent for you. We all need robust amounts of CoQ10, but it's apples and oranges. That's not something that competes with mechanisms of what nattokinase and cardiotone do for you. Mary's on Zoom, says, I have high LDL at 169, high HDL at 110, low triglycerides of 59, so a ratio of 2.7. Doctor said I was at low risk of a cardio event after doing a cardio IQ score 2. Should a person like me take this product? I worry about dementia in older years. Since my mom died of it, I do not want to take statins. Thanks for your advice. Okay, Mary, really good question. So you have a family history of dementia, and it's wise of you to be concerned. And once again, the rule is test, don't guess. So the first test, I would do a full cardiovascular profile. See, the idea of looking at cholesterol and HDL and LDL, that's good, but we started doing that back in the 1960s. You know, that's an important component, but there's so much more you need to look at. There's different types of LDL cholesterol. LDL is not bad for you. It's the raw material that your hormones are made from. Oxidized LDL is bad for you. That's a problem. And so you want to check the different types of LDLs you have and the different types of HDLs. One type of HDL are like scrub brushes, cleaning your pipes. Another type of HDL are hitchhikers along for the ride. They don't clean your pipes. And if you've got mostly the weak, inefficient HDLs, you don't have the protection that you think you have. That ratio of 2.7 is an excellent ratio, but the concept of basing your evaluation of cardiovascular risk on a cholesterol to HDL ratio, that's from the 1970s. And it's a valuable concept, but it's nowhere near complete. So you want a full cardiovascular profile that looks at the things I've just mentioned, plus homocysteine, plus TMAO, plus fibrinogen, plus HSCRP, high sensitivity CRP. You want to look at these markers, all these markers. If you didn't get all that down, go back and listen to it again. But you want those markers. And then for your brain, you don't want to waste any time here. Test, don't guess. It's the Neural Zoomer Plus. And we'll put the link in here. Get the Neural Zoomer Plus done now to see if you have excess inflammation in your brain. And that's my book, You Can Fix Your Brain. That's what it's all about, is making sure that, especially for people, I have a lot of patients who have done the test for genetics for Alzheimer's. And the test is called APOE, APO capital E. And then there's 2, 3, or 4. You get one from your mother and one from your father. So you can be a 2-2, a 2-3, a 2-4, 3-3, 3-4, or 4-4. Now the 2s are very cardioprotective. If you have a 2-3 or a 2-2, you're in really good shape. Don't worry about Alzheimer's, according to genetic risk. But if you've got a 4 in there, you got a problem. You're at much higher risk that your brain just reacts differently to something that's no big deal for someone else, but in your body, it's a much more aggressive response. So when people come back and they're an ApoE4, either a 3-4 or a 4-4, we sit down and I read to them from what I say is, I need to read to you from the book of life right now. You pull a chain, the chain always breaks at the weakest link. So one end, the middle, the other end, your heart, your brain, your liver, your kidneys. Your weak link is your brain. And the pull on the chain is inflammation. That means when you drink a Coca-Cola, your brain goes on fire. When you're eating more sugar than your body can easily handle, your brain goes on fire. And when your brain goes on fire, you're killing off brain cells. Killing off brain cells, killing off brain cells, killing off brain, and you don't feel any of this. That's why you are going to live your life by these markers and make sure that these markers are not elevated. And when you first do the test, they probably will be elevated because you've never looked at this before and there's things that you're missing. But once but your test comes back and you're elevated, then you kind of freak out a little bit, which is a fairly healthy thing to do, to get concerned. And you start looking, okay, I'm reading O'Brien's book, or you're listening to it on audio. I did the audio for the book. I'm very proud of that. It was really hard to do. But you say, okay. So where are the triggers of inflammation that I'm being exposed to? Oh yeah, well, there's a little mold on the shower curtain, but it's not bad. No, get rid of it. Don't just wash the shower curtain off and keep using it. Get rid of it. Get a new shower curtain, and you got to clean the house. So you just have to find out where the triggers are of inflammation that's occurring for you. Could you please explain the difference in nattokinase versus lumbrokinase? Which would be best to treat high D-dimer and HSCRP? The studies on nattokinase are really jaw-dropping. That's why we have it in Cardiotone, is that there are so many studies and it's so safe. I don't know of a problem with lumbrokinase, but I haven't seen the kind of studies that it's as comprehensive. And when I saw what it did for me in one day with my poker chip foundation, And then I pulled up this study that says a single dose of oral nattokinase starts breaking up the clots right away. I was convinced. Now, I'm not saying it's better than lumbrokinase. They both will dissolve clots, but I've just done a lot more reading on nattokinase, and I'm very comfortable, and I've had hundreds of patients now who are taking cardiotone, and the testimonials that we get are just remarkable about cardiotone. Nancy says, better than fish oil. No. Fish oils, that's apples and oranges. Of course we need to take fish oils. But that's different. Fish oils don't dissolve clots. Fish oils help to prevent some clots, but when they've already formed, fish oils, as far as I know, they're not going to dissolve them. So you, of course, want to take, it's not either or. You take them both. You take cardiotone and you take your fish oils. And I'll be doing one of these things on fish oils in the near future, because there's some new information that's come out I'm putting together now that was jaw-dropping for me that I didn't know about, that makes a big difference about quality of fish oils. But in general, if you're getting your fish oils from a functional medicine practitioner, you're very likely getting a higher quality than you would at the local drugstore. That stuff is not very good at all. It's better than nothing, but it's not very good at all. Emily asked, does research look at how it impacts hemorrhagic strokes? No, not that I'm aware of. We know that hemorrhagic strokes, more broken blood vessels, is hemorrhaging. And for that, that's one reason, quite honestly, that's one reason why I take Vitality C. Marzi and I take Vitality C every morning. That it's a alkaline-based vitamin C, and critical important content to make sure your blood vessels stay strong, elastic and strong, is having adequate amounts of vitamin C. And we really like Vitality C because it also has mannose in it. And mannose is, ribose. Ribose is fuel for the furnaces in your cells to give you more energy. So the energy in the cells of your blood vessels make them elastic. They stretch, relax, and stretch and relax. And so we take 1 scoop every morning. Remember, some of you have heard me say, first thing in the morning you wake up, most people go to the bathroom. After that, very next thing, drink 2 big glasses of water right away. And that right there, that's where I put the vitamin C. And so when Marzi gets up, my job's making the coffee in the morning, but by the time she gets up and the coffee is ready to go, there's a glass of vitamin C with it. And so she gets the coffee down first, or I'm sorry, she gets the vitamin C down first, as I do. Then we have our coffee. If a vibrant soy zoomer shows high reactivity soy, is nattokinase still okay to take? Yes, it should be. There's no protein in nattokinase, and your immune system fights proteins. Sandy asks, if nattokinase helps with blood circulation, would it help with neuropathies? Yes, it may. It truly may. As I said earlier, one of the reasons I like nattokinase so much is that this is the #1 cause of death in the world today. And we're trying to do things for it, but I've never seen studies that are as jaw-dropping as some of what I've shown you here tonight about protecting yourself from cardiovascular disease. And nattokinase does that really well. And have it on the end of the spear of adaptogens is really, I'm very proud of that. It's another level of efficacy aside from just taking the enzyme by itself. Logan's on Zoom and asks, can nattokinase help with healing vascular damage, pain caused by the spike protein? If not, what could help? Yes, it can help. Yes, it can help. But in terms of regeneration, we're going to do a Facebook Live pretty soon about regeneration. And Ann will make a note of that, and we'll just schedule it very soon, because there's so much great information now. How do you help your body build healthier, younger cells? That's what regeneration is. And so we'll do a whole thing on that, but nattokinase is a part of that. Colin asks on Facebook, the COVID vaccine is linked to circulatory and heart problems. So would Cardiotone be helpful for people having this adverse reaction to the vaccine? Absolutely, absolutely. As you start reading some of these studies about what's happening for people that are having those types of sensitivity reactions, you see that they've got long strings of clots in their blood vessels. And literally, it looks, by this long. I've seen pictures in multiple studies, and they're saying, what is that? Look at this stuff. Look at how this person is clotting. And it's not just one big clot, it's just strings of this. And yes, colon, nattokinase will help that. That's the job of Cardiotone, is to bring balance to your cardiovascular system. And there's so many ingredients in there. I'm talking about one of them tonight that are designed, and they have many, many studies to show the benefits to normalizing cardiovascular function. AS on Zoom says, are there medications that would make taking nattokinase not so good? I have not seen any. And one of the studies referenced had the same effect. They found no evidence in the literature of contraindications to taking nattokinase. Emily's on Facebook. What are the top triggers of poker chip stacking? Inflammation. In my case, I think it was electromagnetic pollution from flying so much and being up at 35,000 feet. I suspect that's what it was. I eat potato chips in airports, but not that often. And the rest of my life is pretty clean. So I think it was the flying that did that to me. Now when I fly, I take Cardiotone before I leave the house, and I take it with me so while I'm traveling. So Emily, the top triggers of poker chip stacking is inflammation. And in my case, it was electromagnetic. An anonymous on Zoom said, I have no cardiovascular problems that I know of, although I have the factor V latent mutation, making more prone to blood clots than the average person. I'm concerned about the spike protein, however, from my 3 jabs. Are there any risks to taking Cardiotone? Absolutely not. And here is from one of the papers, the black boxes with white print are the 5 different pathways in the clotting process that nattokinase address. So you are, and this was anonymous with the factor V latent mutation. This is exactly meant for you. Thanks so much for asking the question. And that is an absolutely, a Cardiotone is a product for you. And once again, test, don't guess. Get some markers beforehand of your current cardiovascular health. And then 6 months or a year later, studies I showed you tonight said 6 months, recheck. Don't recheck early. You can if you want, but don't expect great results until then. Anne has given me the hook saying it's time. We're over the hour. It just goes so fast. It always does. So thank you all so much for being here tonight. Really a pleasure to talk to you about this. And let us know, take a moment here if you would. Is this kind of information good for you? Do you find this of value? I'd really like to know. If you can give us a thumbs up, thumbs down, or a comment here, just make a comment so we know. If you're still with us and you haven't signed off, then probably it's of value, but give us some feedback so we can learn a little more about if you're enjoying this. Thank you also